Hi, everybody. Hope that you have had a great last few weeks and hope you've learned a lot about growth and development and Maslow's hierarchy of needs and understanding needs. And I hope you got a lot out of the portion about defense mechanisms. If you don't understand that, or if you're still having some issues with those or being able to tell the difference, then please message me because it's really important to understand why we behave and act the way that we behave, and the better that you understand those things, the better you will be with dealing with people. And it'll also help you in your personal growth as well, for sure. So anyway, this next portion on death and dying, if you've already watched the videos and all that, this is not the easiest portion to learn about, not the easiest portion to teach, especially since I just lost my mom, or she's not lost, but since she just passed away on March 15th. And so anyway, I always cry teaching this because it's just hard not to, but anyway, so I'm just going to give you some fair warning. So anyway, so I may pause it. But anyway, we're going to look at I hope you watch some of the videos because I think they do a great job. I picked those videos to, just show you some of the stages of grief, and hopefully you did read and answer these questions on the assignment that I gave you, that what is death sometimes referred to as, and it is sometimes referred to as the last stage of growth. And I have another video that I'll post that is it's a hospice nurse, and I think it's a different culture that she was working with, and just some differences in how they deal with death, and looking at it from as opposed to the end is the next phase. And then the doctor who's considered the leading expert is Elisabeth Kubler-Ross, so that'll be in the presentation as well. And then the 5 stages of grief are denial, bargaining, anger, acceptance, and there's one more that I can't think of right off the top of my head, but we'll get to them. They're all withdrawal. And there are other stages of grief. Okay, those are not just the only ones, but those are certainly considered the main 5 stages of grief. All right. So we are going to look at the emotional and physiological elements of death and dying. The physiological elements of death and dying, when we get to it, those are if the patient is going through a natural death. Okay, it's important to understand the difference between those. Now, that doesn't mean that somebody that dies of a heart attack doesn't have a natural death. They do, but they won't go through these phases like we're going to look at. They can just all of a sudden, clutch their chest and fall down. And if it's a severe enough heart attack, then, they can be dead right then. But so we're going to look at if someone is going through the phases of they are dying, what we consider, if we're allowing their body to die. Anyway, I'm not making a lot of sense with that, but hopefully it'll make better sense when we get to it. All right, so there are some emotional transitions that take place at life's end. These emotional transitions take place for the patient, but they also take place for the family members and the people that are close to them as well. There are many theories about the emotional transitions encountered by dying people, but the best known is Elisabeth Kubler-Ross, and she wrote a landmark work that was entitled On Death and Dying. That was the name of her work that she wrote, and it did identify the 5 emotional stages experienced by dying individuals. So if someone knows that they're dying, so yet again, if someone has a heart attack, then they're not, and it's, they immediately drop dead, they're not going to be able to, they won't have time to go through these. But someone who knows that they're dying does go through these 5 emotional stages. And their family members will as well. All right, so these 5 emotional stages are, the first one is denial. No, not me. Now, that doesn't mean that this is the first one that people will go through. Sometimes it is, but these are in no particular order, and sometimes people can move in and out of these stages during the process. Anger, which is why me, or why my child, or why my parent. Bargaining, or yes, but this is where people try to bargain, or either with mostly with God, with whatever God that they adhere to. And a lot of people, if they're not religious or don't have a personal relationship with Jesus, or with whoever they believe in, they will at this point, or some of them will. Some people makes them more angry. Depression, when they realize it is me, this is happening, and then hopefully acceptance, that it's part of life. I've got to get my life in order and accept what is happening to them. All right, so death can involve fears that are physical, social, and emotional. Obviously, the physical fears are, those are real fears. First of all, is there going to be pain involved? That can be a real physical fear. Also, just the unknown. Even if, no matter what your beliefs are about after death, or how strong someone's beliefs are about after death, there can still be some fears involved in, that crossing over. Social fears, those are, you're going to be left out? Are people going to still want to spend time with you? Are people going to pull away from you? And those are real. Those are real things. I had a friend that lost her husband, and lost him really suddenly, and she, people really didn't know what to say to her, whatever. She was actually, I think, in her 50s, but she was friends with a lot of people that were younger, like in their 20s and early 30s. I think she taught Sunday school at the time of a younger class of younger, age group of people. And I remember one time, a girl that we both knew, she just shared the email with me that a girl had sent her, said, I saw you at Walmart the other day, but I turned my cart around and went the opposite direction because I didn't know what to say. And I realized that was wrong, because, you would have just wanted me to say hello. But those are, people don't know what to say. And so, if you are the dying person, there are some real live, social fears there. And then emotional as well, emotional fears of, am I going to be able to handle this? Is my family going to be able to handle this? All those things. All right, so I kind of just said this. Helplessness, dependence, loss of physical faculties, mutilation, pain. Social, separation from family, leaving behind unfinished business. And then emotional, being unprepared for death and what happens after death. If they're not confident in what they believe about that, then that can have some real fears. All right, so what are the interventions for fears from a healthcare provider standpoint? You just want to allow that person to talk as needed. It really does help as someone is going through a grief process for them to talk about it. You want to avoid superficial answers like, this is God's will. Now, in my personal beliefs, I don't think that's a superficial answer, but it's really not helpful to a dying patient. If they say that, you can agree with them, but you just have to be really, really careful that you don't offend or make things worse for them. You can't, I'm not saying that if they ask, about your personal beliefs, that you can't share those. Because yes, you can, but you just need to be really cautious. And even saying things like, well, they're going to go to a better place. Not everybody believes that. So, I had a lady say to me one day, as we were talking about this, that, I think a hospice nurse had said that, which they're not supposed to say that. They have a lot of training in that they're not supposed to say that unless the family says that. So like when my mother was on hospice, I said that, straightforward from the beginning, that we absolutely believe that she was going to be with the Lord in heaven, and that, that our nurse didn't need to feel like she wasn't able to say things like that. If those were her beliefs, if they weren't, that was fine too. But this particular person that I was talking to, I think a hospice nurse had said that, and and I said, well, I mean, if you know the family's beliefs, I think it's okay. And she said, no, it is not okay to say that ever to anybody, because a better place for her to be is here with me. And, I mean, she was angry. I mean, she was angry that her mother had died. I understand that. I really do. So just be really cautious. Provide religious support as appropriate. So if this is someone who, you want to allow their, their pastor or their chaplain or, whatever, to be there. Now, as I'm teaching this, everything has changed in the midst of COVID-19. And whether or not it will go back to how it was before, I honestly do not know. It breaks my heart that so many thousands of people are dying. I mean, we've had 37,000 people die from COVID-19 as of, that was yesterday's numbers, and so April 18th in America. And those people died by themselves. They probably had a healthcare provider with them. But they didn't have any family. So the time for you to understand this is now, because things may never be the same. I don't know. I know that for me with, in labor and delivery and the nursery, the mother is allowed one support person. And then after that baby is born, the baby is considered a patient and the baby is allowed two support people, but one of those is the mother. So basically the mother and the father, whoever that mom picks as her support person. If the father's not involved, then, the mother and the grandmother, or the mother and the friend, or, whatever. Even there's been a lot of fears surrounding that, and providing support for these people has even been important in my area, even though it's a area of life as opposed to death 99% of the time, thankfully. All right, so stay with the patient as needed, like I said, with right now, and not just patients that are dying from COVID-19, but patients that are dying from other things. Or we've made some allowances at NAMC, and Helen Keller is making some allowances as well, allowing one or two people to be with their dying loved one, but that's it. So that's hard. I mean, I can't imagine if I hadn't been able to be with my mother. That would have made it even worse for me. So these families are dealing with, real pain right now. And you do want to work with families to strengthen and support. Now, if they're not, like right now, I know it's the healthcare provider's job. They are, they're talking to these families on the phone a lot, just trying to keep them updated, to help strengthen and support the family. But that, they're doing it by phone. Hopefully we'll go back to the time that we're, doing it face to face. All right, so this was a video that I hope you watched. I'm not going to play it because it echoes if I play it, while I'm recording. Anyway, but that's why I put it on there. I feel like this video does. If you've never seen the movie Steel Magnolias, it's a great movie. It's a very sad movie, but it's a great movie. Lots about the main character has diabetes, and there's lots of really great medical things you can learn from it. What I love about this clip is that Sally Field, who is an amazing actress, she's older, so you might not have ever seen her. She really, you almost see all the stages of grief right here. She's angry, and then And then she even denies it. No, this is not happening. It's not supposed to happen this way. It was always, I'm ready to go first. It was always supposed to be me, so that's even bargaining, it's supposed to be me. And just, you just see just great despair. And, it's just really, it's very moving, to me, because I've seen the movie multiple times, but anyway, you definitely see denial, you definitely see anger, and then she withdraws, she's withdrawing from her friends, and then toward the end, they make a joke out of things, and then you see acceptance. Now, that doesn't mean that she just, in this 2-minute clip, however long it is, that she's gone through all those 5 stages of grief and it's over with. No, I mean, I don't think this is in my little presentation, but for an expected death, that means, like, for me, for instance, I knew that my mother was going to die. I mean, I didn't know when, but I knew that she was that the disease that she had would be what took her life unless something happened sooner. So I knew she was going to die. It was an expected death. That takes about a year for someone to go through the grief process. Now, that doesn't mean that they won't have like grief bursts, just an outburst of grief for years. I mean, you could, sometimes I still cry over my grandmother dying. I mean, I think someone that loses a child, you never get over that. So it's not adjusting to how life is now. So adjusting to how life is now for an expected death is about, a year. Whereas an unexpected death, like someone very close to you died in a car accident, just really suddenly was taken, that is 4 years. So that's a big difference. 4 years to adjust to life as it is now. So hopefully, can give you some guidance, maybe if you've known people that have lost people close to them. All right, and then this video, I put this one in here just to sort of show you that, this was not really a good way for her to handle it. But this character, I can't remember her name, you saw how Sally Field responded of being like, well, you just go ahead and rejoice, but I'm sorry, I don't feel like it. She wanted her daughter. So, all right, this is the one I'll post later. Okay. All right, I'll post this one later. This I'm going to turn into a worksheet or, something for y'all to do to match the following. So I'll get that on there for you. This is a good one. I'll post this for you to watch as well. Okay, so let's look at the physiology of dying. This part is kind of hard. It's hard, okay? This is the physical, what you actually see when the person is expiring or when they are dying. So this is going to be hard for me. I've kind of put off doing this because I did, go through all of these phases with my mother. And it was difficult. It was difficult for me. It was difficult for my children. It was difficult for her. I hope that she was not in a lot of pain. But because she wasn't able to communicate, we really don't know exactly. But, we tried to do everything we could to, so that she wouldn't be in pain. All right, so somatic death, this is the death of the body. When the body is going through the process of death, this is called somatic death. And there are a series of irreversible events that lead up to cell death. So as the body is dying, these things are happening, and they are irreversible. Like you can't go back and stop it. The cause of death varies, but there are basic body changes that happen in all deaths, and you can see these. People that work in hospice, they're able to say, like, they can give someone a guideline of like about how long they think it'll be. Now of course they can be wrong. Nobody knows the future. A friend of mine, they told her that her, mother had hours left, and 9 days She breathed 3 times a minute for 9 days. And it was horrific on my girlfriend that happened to. And so when my mother was going through this, she said, Elaine, I'm just praying that, it won't be what we went through with my mother. And it wasn't, and I'm thankful. So, nobody knows the future, but normally nurses in palliative care or hospice or whatever, they can usually tell the family about how close they think it is. All right, so basic body changes result in the death of all vital body systems. So as these different changes are taking place, the body is shutting down. All right, so pulmonary, so this usually is the lungs. As they become unable to oxygenate the body, you can start seeing changes. And you're seeing poor oxygenation. The skin is pale, cyanotic or blue, mottled. I need to look up some pictures of mottled because I know what that looks like because I've seen it a lot. But you probably don't know what that is, so I'll look up a picture. As a matter of fact, I can just do it right now. Let's see. Now, mottled skin is not just in death. Yeah. Now, this would be where someone is most likely dying. But you can also see mottling in other things, like mottling in infants. That's when infants are, if they're detoxing from drugs. But this is what it looks like. Almost this lace-like look. So especially on the back of their, if they're laying in the bed, the back of their body will look mottled, and that's honestly where that blood is not circulating, and so it's pooling in the back of the body where the weight is. So I've got the hospice paperwork that they gave me, and it was really, really good, and I learned a lot from it. I'm gonna put that on here too. It was really helpful to us. So this can even start happening in 1 to 2 weeks before death. Okay, they can start having this poor oxygenation. They can, one moment they can be fine, and then another minute their fingertips can be blue, and it's just where their lungs are really starting to shut down. In dark-skinned individuals, you want to look at the mucous membranes, so like the inside of their lips, the palms of their hands, and the soles of their feet. That's where you might see pale, cyanotic, mottled skin. All right, so the heart, as the lungs are failing to oxygenate, there is a large load on the heart, okay? So the heart's not getting the needed oxygen, and the heart is not strong enough to circulate the blood, okay? So this blood backs up, that's causing the heart to fail, and this leads to lung and liver congestion. So the heart is just, all right, so it starts with the lungs. They're not able to oxygenate as well. And so then as the heart's going without oxygen itself, so it can't pump as hard as it needs to. And so it's not circulating the blood. And so then that puts even more pressure on the lungs and more congestion on the lungs and the liver, because the blood is just not circulating the way that it needs to. So the lungs start to fail, which leads to the heart failing. All right, so blood circulation, it's decreased as the heart is less able to pump. They may have a drenching sweat as death approaches. I think I've mentioned this to you when we were talking about different cultures of having them step out, so that you can clean the person up. And it's because they will have this drenching sweat as they get closer to death. And a lot of times their gown will be soaked and their sheets will be soaked. Not always, but sometimes. and that is because of the decreased circulation. Their pulse becomes weak and irregular. And yet again, this can happen, 1 to 2 weeks before death. One minute they can have a strong pulse, the next minute they can have a real thready, weak, can't even find their pulse. If pulse is still relatively strong, then death is hours away. I can remember sitting with my mom and, I was just part of how I dealt with the whole situation is I just put it in my nurse box, okay? So, that was my, I guess, defense mechanism that I was using at the time. And so I checked her pulse a lot, She couldn't respond to us. I don't know why I did it. I don't know if it was helping me feel better. I don't know. I don't know. At the, which we'll get to in a minute, like, one thing is that she was very, everything goes up, like respirations, heart rate, blood pressure goes up, goes like sky high, and then it'll, drop. And so one thing is I just, I wanted to see how fast her heart was beating, because I was also thinking, if she's breathing 60 times a minute and her heart's beating 150 times, number one, it can't keep on like that. And number two, is she in pain? So can I get her more pain medicine? If pulse is weak and irregular, then death is definitely imminent. Like, death is very near. All right, so the combination of these events leads to cell death. And if you remember, when we first started learning about the body, we started with the cell. And then we built up. So we went from cells, so groups of cells form tissues, groups of tissues form organs, groups of organs form an organism. So, but, think of it in the reverse, as this happens, cells start to die. And as cells are deprived of oxygen and they start to die, then the tissues start to die. And as the tissues die, the organs die. And as the organs die, then the organism dies. As the pulmonary and cardiovascular systems fail, then the other body systems begin to fail also. So starts with the heart and the lungs, or lungs and then the heart, and then that leads to the other body systems failing. All right, so the metabolism starts to fail. Their metabolic rate decreases or almost stops. Their feces might be retained, or they might be incontinent, one of the two. They may, they've probably in the last, if they're dying a natural death that's, taking a month or weeks or something like that from cancer or Alzheimer's or old age or, whatever. That people actually do literally die from old age. Miss Quorum's grandmother, the doctor said she truly died from old age. That her body she was over 100, that literally her organs just started to fail because of age. So, a lot of times they have stopped eating and stopped drinking. We think that'll make them feel better, but we think, oh, they need to eat, or oh, they need to drink, and and we try to force that on them. But honestly, because their metabolism is failing, that actually doesn't bring comfort the way that we would think it was. It actually causes them more pain. So they don't have to eat or drink. They really don't. They're going to die if they've reached this phase, and so you can't stop it. And the eating and the drinking can actually make things harder. All right, so the failing urinary system, their urinary output decreases to almost nothing. The blood pressure is too low for the kidneys to filtrate, for the blood to actually go through the kidneys, and the kidneys filter the blood. The blood pressure starts out, maybe a month or so before death. The blood pressure can go sky high. It's just they're just on this roller coaster. It's really, how you sort of know that they're reaching the end stages is maybe their blood pressure is 200 over 100 1 minute and then 80 over 40 the next. But the blood pressure is just too low as death gets closer for the kidneys to filtrate. And this all comes back to, yet again, the lungs are not oxygenating. The lungs are shutting down. Therefore, the heart muscle isn't getting enough oxygen to pump hard enough. Therefore, the blood circulation slows down. And so it's just, it can't filter because the blood pressure has dropped so low. So I hope that makes sense to you. So because now we've got this extra fluid, all right, so now we've got an increased load on the heart because of the circulating volume, because the body's not getting rid of it. The kidneys are not getting rid of the waste. They're not getting rid as these cells are dying and should be being filtered out and be passed out through the urine. It's not happening. So now we've got this further cardiovascular load. So now the heart is even under more stress. All right, and then the nervous system starts to fail, or along with this, there's decreased oxygen to the brain, meaning decreasing brain function. They start having a sensation and power lost in the legs first, and then the arms. They may remain conscious, semi-conscious, or comatose. A lot of times, as when they've reached this phase, a lot of times they are not, they could be in and out. They may be semi-conscious, or they may just stop responding completely at some point. At some point, they may have totally stopped responding. All right, so specific sensory decline. The dying person turns toward light. They can only, if they're opening their eyes, they can only see what is very close to them. So, I think we've probably seen on television, or it's just our nature to get close to people that we love. But they really, if they can still open their eyes, they can only see what's near to them. They can only hear what's distinctly spoken. However, the hearing is the last thing to go. And so hospice does encourage you to continue to speak to your family member. We continue to talk to my mom and pray and sing with her, all the way up, or sing around her. She wasn't singing, but and it brought us a lot of comfort and peace. But I had to tell my dad. I mean, people deal with this differently. Here's the thing. A lot of you, you're going to be the one. You're going to be the one to be there with your family member. You're going to have to be the strong one, because a lot of your family members won't be able to take it. And it will fall to you because you'll be the nurse or the doctor or the physical therapist or the occupational therapist or whoever, or you're just the daughter or the son. And so it's going to fall to you. And so, because it fell to me. And anyway, so, continue to talk to those people. It doesn't matter if they talk back. Just continue to talk to them, because according to all research, they can hear. That is the last thing to go. Their touch is diminished. Response to pressure is the last to leave. So, this would be, there's a real, I think it's just kind of in our nature, to squeeze someone's hand, but they can still feel that. That's the last as far as like the touch that they can feel. They may turn toward or speak to someone not visible to anyone else. So, this is real. This is not, I'm not making this up. I mean, they may, interestingly enough, I have seen dying people talk to their parents, talk to a child that has gone on before them. They will say that they, have seen people that have been dead, but had gone for years, Are they seeing glimpses of the afterlife? Are they seeing glimpses, I don't know. We don't really know. But most of the time, this brings peace to them, I know my grandmother, she And I can't separate, as I'm talking about this, I can't separate my own personal beliefs. I'm not asking you to ascribe to them in any shape, form, or fashion. But I can remember my grandmother, telling people the last week that on this planet, everybody that came to visit her, she said, I want you to pray that Jesus will take me home. Not pray that I'll get better, but pray that Jesus will take me home. I'm ready to be with my mama. I'm ready to be with my daddy. I'm ready to be with Herschel. That was her husband, my grandfather. I'm ready to be with Jesus. And I mean, she was serious. Like, she was serious. She was very serious. And that next week she got her wish. She died in the middle of singing a hymn. She passed from this life to the next. Their eyes may remain open even if they're unconscious. Their eyes, can kind of even have like a haze over them. That can be uncomfortable for the family. So you may need to use eye drops or close their eyes. Their mouth, they normally end up, their mouth gets very, very dry. So using the sponges and a lot of times family members will be comfortable with doing that themselves. Sometimes they won't. Just depends on, the family. And the person might rally just before dying. So, okay, y'all, I mean, I've just seen this over and over and over and over. And if you've had a family member that's died, that had cancer or something, you may have seen this. And what it means by rally is they'll have like a really great day. Like maybe on Wednesday, they're doing really poorly. And I mean, this is exactly what happened to my mom, but I could tell you so many stories, okay, of people. But like on Wednesday, the Wednesday before I was out on that Friday, and then we never came back to school. So that Wednesday they called and said, well, actually on Tuesday, her hospice nurses told me that she was having trouble swallowing. She was getting choked. And that's kind of the final stages of Alzheimer's, is where their body they think that they forget how to swallow. And so she was really having trouble swallowing, couldn't swallow. And so on Wednesday, she got choked really bad. She almost like aspirated, and they were afraid she was just going to die, like choked to death. And so they wouldn't give her medications anymore. And so that was on Wednesday that she got her last dose of medications orally. And so then on Thursday, she had like this fabulous day. Like she walked all over, like she walked better. She didn't have to have any assistance. She walked all over the Green Oaks. I mean, she talked more. Now her talking was not, she still wasn't really able to, make like a coherent sentence or anything like that. But she definitely was talking and laughing and friendly. And, she had a great day. When I got there on Thursday afternoon, she was sitting up in the dining room. Then Friday morning when I got there to get her, because I was having to move her out of Green Oaks, she was just almost semi-conscious. She was not able to get out of bed by herself. We had to help her, and then we had to get her to the hospital because she was becoming really just restless from not having the medications. So anyway, and so that was Friday, and then she died Sunday morning and she was never conscious again. She never responded to us again, like after Friday afternoon. So Thursday was her rally day. I mean, but I have seen it so many times. I mean, sometimes people will say, oh, I think they're getting better, and then they'll die, which is just, sometimes it can be like so horrible to see that, but they're not getting better. But it is good. I think that rally, I think the rally day is, I think it's the time for the family member to, for their family to hopefully remember some of the good times that they had with them. All right. Further neurologic decline at death. Their pupils might not react, or they may react sluggishly or not at all to light. So, using the pen light, or, their pupils may not get bigger and smaller. Their pain may be significant. This is the part that's, as the cells are dying and as their organs are dying, the pain could be significant. So this is where, hospice comes in with, they do like morphine, they do Ativan, and they do Phenergan, which helps. And they do Reglan also. Reglan slows down the gastrointestinal tract, so if they're having pain from that. How do you assess for pain if the person is unable to talk? You look for restlessness, you look for tight muscles, facial expressions, frowns, also going by their vital signs. I mean, if they're, remember that heart rate or tachycardia is, and tachypnea are signs of pain. So, if you see that, if their heart's beating 150 times a minute and they're breathing 60 times a minute, assume they're in pain. Because like I said, there is no turning back here. I mean, so it's just trying to help them, pass as peacefully as possible. Yeah. So provide pain medication as needed. Is this going to expedite their death? I mean, maybe, but the whole, you're not allowed to give them, hospice. If you're at home, they can give those medications every hour. In a hospital setting, they can give those every 2 hours. Yet again, the end result is the end result. So, it's not going to kill them. Any pain medicine that they're given, it's not going to kill them. What their body is doing is going to kill them. All right, so never lose sight that death is the end of physical life for that person. It is the end of that physical life. There'll be no more growth. There'll be no more memories. There'll be no more anything as far as physical for that person. And so it is painful. It is difficult, no matter how prepared they think they are, no matter how prepared the family thinks that they are. They're not. We can only support, listen therapeutically, and make the person as physically comfortable as possible. I am so thankful. And I'm going to post a couple of things that I've written over the past few weeks since my mother passed away. Just for you to, just you can read it and analyze it if you want to. You can analyze me if you want to. But I'm so thankful that my mother died before this COVID-19 got really bad, because I was able to be with her, our family. I was with her by myself when she died, but that was what I wanted. I wanted to be with her by myself. Give me just a second. I just felt like all this time that, she was there when I took my first breath. Actually, I formed in her womb in the hidden place, and I wanted to be with her. It was just she and I when when I was born, because at that point, they didn't let dads come back and all that stuff, and my dad didn't feel like he could take it, and my brother didn't feel like he could take it, and I wanted to be there with her, and it was a beautiful moment in time in my life. There's a lot more that I could say about that, but they all do have to do with my personal faith. So if you want to hear more about it, I'm happy to share it with you personally. But it really was a beautiful moment in time as my mother took her last breath. But I'm so thankful for those nurses that were there. They're amazing people that were there. And I mean, there were no shortness of hugs. And I think there is now, because of what we're dealing with the pandemic. But, I don't know what I would have done without those healthcare providers. And it wasn't just the nurses, it was the respiratory therapists. I mean, just everybody that we came in contact with, her physician. It was just, they just made it so bearable. And I'm honored to be a healthcare provider. All right. We can also use our knowledge and expertise to strengthen support and prepare the family. The hospice nurses were wonderful. My mom died on the weekend, so we didn't have the one that we had all along. But they were just amazing. I don't know if any of you have that calling in your life to work with people and end stage life, the end stages of life, but I tell you, they're some of the most amazing people I ever met. All right, so that is the last little portion of this. So I'm going to post a couple of other things, and then I'm going to post something else that I haven't made yet because I've actually never taught it, but I think it's important, about dealing with inappropriate forms of grief. And you're like, what? But there are, and when I say inappropriate, I mean, that the world looks at it as inappropriate. But I think it's important to discuss that, talk about that. So anyway, that will be in another video. And after this, this is the last portion that I will post a test on. Of course, the test is going to be open note. I'm going to try to make it timed so that you do have to be familiar with the material, okay? Because I really do want you to learn this stuff. I miss you guys terribly. I want you to know that. Really, really, really. I'd love to know what's going on in your life. Please send me an email, shoot me a text. But anyway, and I do want to tell you guys thank you. I don't know if I did, because honestly, the week after my mother died is just sort of a blur. And I know I got a lot of text messages from you guys, and I appreciate it so much. I don't know if I told you thank you, but I do really appreciate you guys. You guys are my people. And so I just wanted to tell you thank you. All right.